You know that feeling, right? That tightness in your chest, that almost panicky sensation where you just can't get enough air? It's really frightening. Well, today we're going to break down what's really happening when you feel short of breath. I mean, it could happen after a really tough workout, or maybe just walking up a steep hill, or, even when you're super stressed out. That feeling, some people call it air hunger. It's something almost all of us have felt. And it's your body trying to send you a really important message. So there's actually a medical term for this, dyspnea. And the most important thing to know about that word is that it's subjective. What does that mean? It means it's not about what some machine says, it's about your personal experience, your feeling of discomfort. Now, sure, it's totally normal after you go for a run, but it starts to be a real concern when it sticks around for more than a month, or if it just feels way, way out of proportion to what you're actually doing. Okay, so a really good way to think about dyspnea is to picture it as your body's own internal alarm system. Seriously, it's this blaring signal that something's off. Either you're not getting enough oxygen or the whole system that's supposed to deliver it is, well, it's struggling. And just like a fire alarm, right? It can be triggered by a whole range of things, from something pretty minor to a full-blown emergency. So, what's usually setting off this alarm? Well, the numbers here are pretty wild. It turns out a whopping 85% of cases, 85%, can be traced back to a handful of common conditions, and they almost all have to do with the heart and lungs. We're talking about things like asthma, COPD, which is chronic obstructive pulmonary disease, and heart failure. So if we break it down, the causes fall into a few big buckets. First, you've got your pulmonary issues, so problems with the lungs themselves. Think stuff like interstitial lung disease, which is basically scarring on the lung tissue. Then, you've got cardiac causes, heart problems, like coronary ischemia, where your heart muscle just isn't getting enough blood. But here's where it gets really fascinating, that other category. This is what shows us that feeling breathless isn't always just about your heart and lungs. And sometimes, that alarm is signaling a true life or death emergency. What you're looking at here, this is a CT scan showing a pulmonary embolism. That's a blood clot that's traveled and gotten stuck in the lungs. This is an absolutely critical situation that causes sudden, severe shortness of breath. It's a really stark reminder of why you have to take this symptom seriously. But, the alarm isn't always signaling a five-alarm fire. Sometimes the triggers are way more subtle. Take anemia, for instance. That just means you don't have enough red blood cells to carry oxygen around efficiently. Or simple deconditioning, which is a fancy way of saying you're just out of shape. We're also seeing it pop up a lot with post-viral stuff like long COVID. And maybe the most surprising trigger of all, your own state of mind. And that brings us to what I think is one of the most fascinating parts of this whole topic, the incredible connection between our minds and our bodies. So let's dive into something called the anxiety breathlessness loop. Yeah, there's this quote from the American Academy of Family Physicians that just nails it. It says that our perception of being breathless isn't just one physical thing. It's a mix of a bunch of different signals. And here's the kicker. How we react to that feeling can kick off a feedback loop that just makes everything so much worse. And that's how you get trapped in this vicious cycle. Here's how it works. It starts with anxiety, right? That kicks your body into fight or flight mode. Suddenly, your breathing gets all fast and shallow. That change in breathing creates the very real physical feeling of breathlessness, which, of course, makes you even more anxious and panicked. You see, it's a loop that can just spiral and spiral. But, and this is a really hopeful but, understanding this mind-body link is a total game changer. It's opening up a whole new frontier for treatments. We're shifting away from just looking at the lungs or just looking at the heart, and instead we're starting to treat the whole person as one big interconnected system. So that leads to the big question for scientists, right? If the physical feeling and the mental reaction are so tangled up, how in the world do you create a solution that tackles both at the same time? Well, one really exciting new answer is something called CALM therapy. It stands for Capnography Assisted Learned Monitored Breathing. It's a super innovative mind-body therapy that's being studied for patients with COPD. That's the lung condition we mentioned earlier that often comes with a ton of breathlessness and anxiety. So how does this calm therapy actually work? It's a pretty brilliant mix of mindfulness and technology. Basically, patients are guided through these slow breathing exercises, but at the same time, a machine is giving them real-time feedback on their CO2 levels and how they're breathing. This is huge. For the first time, they can actually see the direct link between what's happening in their body and how they're feeling. It gives them the power to take back control. And the whole goal here is simple: to break that cycle, to stop the dyspnea and anxiety from feeding each other. For a lot of these patients, jumping right into traditional pulmonary rehab, it's just too much. It's too scary. Calm therapy acts like a bridge. It gives them the skills and the confidence to manage their breathing and anxiety first, which then makes it possible for them to move on to other treatments. Okay, so inspired by all this amazing stuff in Calm therapy, let's talk about a practical toolkit, some techniques that you can actually try yourself. These are really simple but super powerful exercises, and they're all based on that same core idea that if you consciously control your breath, you can directly influence both your body and your mind. First up is something called diaphragmatic breathing. You might know it as belly breathing. This one is amazing for calming your whole nervous system down. So, lie down somewhere comfortable. Put one hand on your chest and the other on your stomach, just below your ribs. Now, when you breathe in slowly through your nose, the goal is to only have the hand on your belly rise up. The hand on your chest should stay pretty still. That's how you know you're using your diaphragm correctly, and it's what gives you that super deep, relaxing breath. All right, technique number 2 is pursed lip breathing. This is a fantastic one for slowing your breathing rate right down when you feel it speeding up. The whole trick is to make your exhale last twice as long as your inhale. So you breathe in through your nose for about 2 seconds, then you purse your lips like you're about to whistle, and you breathe out slowly through your mouth for 4 seconds. That little bit of back pressure you create actually helps keep your airways open longer, and it can bring some pretty immediate relief. So what's the big takeaway here? I think it's that breathlessness, dyspnea, it's not just some simple symptom. It's a really complex signal from your body. It involves your lungs, your heart, your blood, even your mind. And the absolute first step toward managing it is just learning to listen to that signal and understand what it's trying to tell you. And that really leaves us with a final, kind of powerful question to think about, doesn't it? In this world of high-tech medicine and complex procedures, could it be that for so many of us, the real answer, the first step on the journey to breathing easier, begins with something as simple and as profound as just a single mindful breath?